Thank you, Speaker. Regional health has been in the headlines a lot recently, not always for the best reasons. It is a human system and it's not perfect, but the people who work in it do outstanding work each and every day. Today, I really want to celebrate what's been achieved in Dubbo to ensure the people of the region can access the best care possible close to home. Earlier this year, I was really excited and proud to stand alongside our Regional Health Minister Bronnie Taylor, local federal MP Mark Colton and former Deputy Prime Minister Barnaby Joyce to officially open stages 3 and 4 of the Dubbo Hospital redevelopment, including the $35 million Western Cancer Centre. The Dubbo Hospital redevelopment has been the culmination of over a decade of hard work and $300 million worth of investment from this coalition government. I'm incredibly proud of this achievement, but it's also very important to pay tribute to all of the people, many of them right across the region, who have worked tirelessly to make this a reality. It's fitting to start with the Dubbo Health Council, a group of individuals, many of whom have spent decades advocating for improved medical services, not just for Dubbo, but for people right across Western New South Wales. Members have included Rhonda Gleeson, Elizabeth Allen OAM, Steve Bassett, Rhonda Bramble, Shibli Chowdhury, Nola Honeysett, Robin Payne, Bernadette Underwood, Carney Walford, Lorna White, Jeff Wise, Virginia Woodlock and Dot Martin. The Health Council played an integral role in advocating for the car park project. Jeff and Steve were on the LHG's working group and their work made my job securing funding a lot easier. A number of members were also part of the Western Cancer Centre Consumer Committee, which helped with the planning and design of the new facility. There was Rhonda Gleeson from Dubbo, Louise Brown from Burke, Stephen Dutton from Cobar, Joanna Parker from Lightning Ridge and Grace Toomey from Dubbo. Tony Barlow was a community representative from Narromine who sadly recently passed away from cancer. And of course, Lynn Smith, who along with her fellow Dubbo West Rotarians really got the ball rolling. It all started when Dubbo Hospital oncologist Dr Florian Honeyball spoke to members of the Dubbo West Rotary Club about the need for a PET CT scanner in Western New South Wales. So after some initial discussions, the club set its sights on delivering an entirely new cancer centre for Western New South Wales, and the support from communities across the West was overwhelming. Nearly 46,000 people signed a petition, which helped Mark Colton secure $25 million in federal funding, and my predecessor, Troy Grant, and the New South Wales Government backed the project in with $10 million in the commitment to deliver the project. The Western Cancer Centre is now open and saving lives, a true collaboration and a wonderful example of what we can achieve when we all work together. Some of the many people who played a pivotal role in the Dubbo Hospital redevelopment and the Western Cancer Centre are from the hospital, Dr Honeyball, Dr Colin McClintock, Dr Joe Canalisi, Oncology Nurse Unit Manager Tim Williams and General Manager Debbie Bickerton, Marcus Haynes and Belinda Berryman from New South Wales Health Infrastructure, and Kerry O'Neill, Regan Woodman and Benita Jamison from the LHD. All up, we've delivered a new clinical building featuring 6 new operating theatres, a day-only and extended day-only ward for surgical services, an inpatient ward and birthing suite for maternity services, a special care nursery and a central sterilisation department. We then delivered a new surgical inpatient unit above maternity in the new Talbragar building, as well as a new renal dialysis unit, including 14 dialysis chairs, 2 training rooms, 2 consultation rooms and an expansion zone to allow for 4 more dialysis chairs. Stage 4 delivered another 3-storey clinical building, the Macquarie Building. That includes a new emergency department and short stay unit, a medical imaging unit, a critical care floor including coronary care, stroke and intensive care units and a cardiac cath lab, an ambulatory care unit and new front of house and drop-off zones. And of course, there is that $35 million purpose-built Western Cancer Centre co-funded by this government in partnership with the former federal coalition government. That includes 16 chemo spaces, doubling the previous capacity, a radiation therapy bunker, a PET CT scanner, new consultation rooms, a wellness space and a front of house and drop-off zone. It has been a dramatic uplift in services, making top-notch healthcare more accessible for people right across our region. But of course, more patients means more cars, and where will they all park? Well, I'm proud to say that we delivered $30 million for over 350 additional car spaces at Dubbo Hospital, and we have delivered. In the past 12 months, we've opened not 1 but 3 car parks, including 1 dedicated to patients of the Western Cancer Centre, and of course the new multi-storey complex containing over 300 car parks. So now, in the Dubbo Hospital campus, almost 1,000 car parks for patients, visitors and staff. Building top quality state-of-the-art health facilities is a recruitment strategy and it works. I've been lucky enough to meet some of the amazing health professionals who've moved to the region to work in our new facilities, like Maddie Mackenzie-Lindgren, who moved to Dubbo to work at the new cardio cath lab. Keep it coming. Dubbo Hospital is truly a great place. Still not quite done, but we'll keep supporting Western New South Wales.